shorter. That to make it summarize, I will help with this. She's a graduate, she's a student, undergraduate of social work degree program. So we want more younger people to talk about elderly needs. So they will make sensitize them one day. So there we, with all this finding, to make it adaptable to our country and the cultural context, we came up with this eco model where we need to, based on all these facts that we presented here. So we think we need to go for a proper statistics in this country about the elderly population needs, and then it has to align with all these sectors. So if it is the community-based care, the community care integrated program, home-based care systems, we place in the central part. So all the other sectors has to work aligned through this system. So for example, healthcare has to place in a line and social services has to be placed in a line. So under the social services, we have social service officers, and in community-wise, community volunteers, social work volunteers, elderly group leaders are there in the community. And also, like, for them to establish and run these programs, they need to get some financial support from the government or the private sector. And the other side, all these calculation has to go up to the policy level. If we are only to touch upon the data and the current existing program will not sustain. To run a sustained program, we need to have a policy level discussion, a lobby, advocacy has to be there. So for all the research that we are discussing today, the community development program that we have done previously and currently has to come to one certain level, and based on those evidence, we can develop a proper elderly care policy in this country. So aligning with that, we need private public sector partnership to work together, because only the government can't support the elderly population's needs. So the private sector also has to come forward, link up with their CSR projects to support the elderly population needs and their program. So I heard, and we are waiting to hear about the healthcare insurance policy for the elderly population, which is going to be a good thing for our community as well, because elderly population and migration also another big problem in this country. And again, the NGOs, INGOs, community-based rehabilitation organizations, and the day centers, daycare centers for elderly people. And all these sectors need a thorough training program on how to provide proper care for these people in the community, and much more community awareness programs starting from schools to larger population. And one suggestion came out from our group that we have all the helplines for mental health, child abuse and everything. For the elderly care assistance in this country, we don't have a helpline. Even an elderly person want to get a call and I want to find the nearest residential care institution details or whatever, like to get all this systemic information, it's better to have a helpline for them as well. So just to sum up, thank you for all the group work, for their hard work, and I'm just to facilitate them.
象的にそのコミュニティケアインテグレーションホームベースケアシステム自分の国でその長期的なケアをやっている人たちにも渡されて、そのメインシステムをいくつかのセクションに分けて関係本当カネクトされていなければならない。一つはヘルスケアというのは病院とかそうやってそしたらもうお医者さんとか死にそうな時、その死にそうな患者のためにどうすればいいか、それもパラキケアと書いてあります。それも関係する全ての調査の全部だからそうそうデータシステムそう